Hello and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. If we're able to revive someone's heart and save their life, it will give us great satisfaction. It's sad but true, a fact that a number of people dying of cardiovascular diseases is steadily increasing in India. Most of these cardiac deaths occur suddenly and on the spot. These sudden cardiac deaths can be prevented if the affected people are given immediate medical attention and CPR. The recent cases of celebrities who suddenly collapsed and died of heart attacks are eye-opening and shocking. The risk is higher in patients with existing heart disease. Almost every family has at least one family member with a heart condition. What if you can save a life in an emergency situation? Yes, this is possible if you're well trained in cardiopulmonary resuscitation. Many adults who suffered a cardiac arrest can be resuscitated with their neurological functions intact if bystanders perform CPR immediately. Raising public awareness about the practical application of CPR is an important strategy to increase the success of CPR in cardiac arrest. Save a Life is an initiative to make people aware of the early signs and symptoms of cardiac arrest so that patients can get to a hospital in time and be trained on giving CPR if needed. Today we have cardiologists who are going to help us and give us more information about this to increase awareness. We're joined by Dr. Riaz Mujawar, a consultant and interventional cardiologist, Wanless Hospital, Miraj Heart Institute, Aryan Heart Center, Sangli. Dr. Sanjay Bhatt, Senior Consultant Interventional Cardiologist, Astor CMI Hospital, Bengaluru, and Dr. Rizwan ul Haq, Senior Consultant and Interventional Cardiologist, Apex Super Speciality Hospital and Research Center, Solapur. Thank you so much, doctors, for joining us on the program. And Dr. Mujawar, I'd like to start with you. Indians are seen to develop heart diseases at an early age compared to Western populations. If you could tell us about that. Also, heart disease tends to progress more rapidly and has a high death rate. Why are Indians more prone to heart disease?
Yeah, Indians develop heart disease at early age, 5 to 10 years than the Western population, not only in India, but also in migrated Indian population also. The major reason behind the increased heart rate in Indian, it is because of Indian people's genes are more prone to develop heart attack at earlier age. Also, the change of the Indian diet from the traditional high fiber and low fat diet to the high carbohydrate and low fiber Western diet leads to increased obesity, diabetes, increased dyslipidemia, and which lead to development of the heart disease in Indian population at earlier age. There is increased mortality in Indian population. It is due to the lack of early diagnosis and treatment for the heart attack in Indian scenario.
All right, Dr. Haq, a competitive lifestyle keeps this generation constantly stressed. Can constant stress cause sudden cardiac death?
Yeah, Gagi, that's a particular question. Today we are encountering a lot of celebrities, as you have rightly pointed out. See, whenever we are in stress, our body responds to it by production of adrenaline. And this tend to give rise to ventricular ectopic beats, sometimes ventricular tachycardia, and sometimes sudden death. So constant stress is an important risk factor for cardiac arrest in our life. Emotional distress may also trigger ventricular tachycardia and cardiac arrest. So stress is a very important factor in today's life to cause cardiac arrest.
All right, Dr. Bhatt, can high-intensity exercise acutely increase the risk for a sudden cardiac arrest or sudden cardiac death in individuals with no prior history of heart disease? You know, there have been a couple of famous cases of people having a cardiac arrest in the gym.
Yes, Gargi, it is advisable not to do HIIT. There is a very high risk of cardiovascular events because of three factors. One is plaque rupture. Even in a person who has no blockages in the arteries, overexertion like in HIIT can precipitate a normal artery, the lining to rupture and clot formation and precipitate a cardiac arrest. Another is irregular heart beating like ventricular tachycardia, ventricular fibrillation. Sudden overexertion can precipitate cardiac arrest because of irregular heart beating. Another, this can also precipitate rupture of small arteries in the brain hemorrhage and precipitate death. So we do not advise people to overexert themselves. We have a J-shaped curve. That is, people who are sedentary have a high mortality. People who have moderate intensity exercise, the mortality because of cardiovascular events reduces. Whereas people who overexert and do high intensity exercise or do long distance ultramarathons, it has been demonstrated that in them the mortality rate is higher than in the normal population. and more than even people who are sedentary. So HIIT is definitely to be avoided. What we advise is a moderate intensity exercise that is beneficial to the cardiovascular.
Right, Dr. Mujawar, there's a common misconception that heart attack and cardiac arrest are the same things. Can you please explain the difference between the two?
Yes. Cardiac arrest and heart attack is a totally different thing. Heart attack occurs due to the blockage in the coronary arteries, which leads to the decreased blood supply to the part of the heart. Here we get some time for the treatment of the patient, but cardiac arrest, there is electrical disturbances which can lead to the heart which is totally stopped from the beating. Cardiac arrest is more dangerous than the heart attack, but some patients of heart attack can develop sudden cardiac arrest. Heart attack is a blockage problem, and sudden cardiac death is occur because of the electrical problem.
All right, Dr. Haq, what are the chances of surviving a sudden cardiac arrest?
Yeah, Gagi, that's a very interesting question. The cardiac arrest occurring in an hospital, in an ICU, has a different outcome than occurring in a hospital premises, than in an outside world, because every minute we tend to lose our patients. Patients, those who have cardiac arrest in ICU, in a hospital, has got a fair chance of survival because they can be attended very fast in a quick manner. They have a chance of almost 20 to 30% of survival. And those patients which are away from ICU, but in the hospital, tend to have a survival between 18%, 16% rates. Whereas totally outside the hospital cardiac arrest, they tend to have worse prognosis because they need to be attended as early as possible and taken care. It is said that the survival rate is around 7 to 10%. With every 1 minute, the chances are of losing the patient keeps on increasing. If we have a bystander who is well acclimatized or trained in doing a CPR, then the chances of survival will dramatically increase even in these patients. I would recommend in this case, in CPR, one more important step is giving a defibrillation shock. If this is available, this is a game changer. Any patient who has a cardiac arrest, defibrillation is the primary treatment in which the patient can survive. While CPR maintains a good circulation to the brain and keeps a chance of survival and reaching the hospital very good.
All right. And now, Dr. Bhatt, we're talking about CPR and not being a bystander, actually helping to save someone's life. So if someone is having a heart attack or cardiac arrest, what emergency action should be taken by a bystander?
This is a very relevant question. There is a difference between heart attack and cardiac arrest. Heart attack is because of blockage in the arteries, and it has to be attended immediately by an interventional cardiologist. Symptoms of heart attack are chest pain, breathing problem, new onset tiredness, giddiness, palpitations, loss of appetite, a sense of indigestion, and even patients can present with loss of consciousness. Cardiac arrest also can be a presentation of a heart attack. In heart attack, the blocked arteries have to be opened up as early as possible. Here, what we call is time is very important, and there's a concept of golden hour. So within the first 1 hour, 3 hours, 6 hours, 12 hours, or 24 hours, the mortality and the benefit of treatment worsens. So as early as possible, the person should seek out care, and the immediate treatment they can take at home is by taking a blood thinner tablet, a simple aspirin tablet, 100 milligrams, and come out to a nearest healthcare center, get an ECG done, and we do further testing like looking for heart muscle enzymes, troponin. We do an echocardiogram, and if it is confirmed to a heart attack, an interventional cardiologist is the ideal person to attend on these people. There's a lot of misconception among people that they are unnecessarily treated, stenting is being unnecessarily done, but this is totally false news, and people should be made aware that early treatment for heart attack is very important, and as early as possible they should go for a angiography, that is a test to look for blockages in the arteries, and the blocked arteries, if needed to be treated, has to be opened up as early as possible. Medicines are only first aid. They will not give immediate or long-term, long-standing benefits. So in addition to medicines, these arteries has to be opened up. And that is by doing an angiography and angioplasty where the blocked arteries has to be opened up. And in this, a critical role is by the patient and their family members to seek out care and get the treatment done as early as possible. If not treated on time, they will end up having cardiac arrest or heart failure. For any heart attack, there is a very high mortality. Up to 90% of people, if not treated on time, will have a bad outcome in the next few days, weeks, or few months. So this is a very important thing for them to seek for care. And cardiac arrest is a totally different scenario where a heart stops. It could be because of heart attack, a drowning, road traffic accident, electrical shock. Is a end-stage phenomenon where the heart stops and because of irregular heart beating or stoppages of heart activity. So for cardiac resuscitation is the ideal treatment for cardiac arrest, which has to be done immediately by the patient bystanders. They should ensure that the person is conscious, unconscious, and if he is unconscious, not responding, immediately they should initiate a procedure called cardiopulmonary resuscitation. This is where they start chest compressions, and this has to be continued by the person until the person becomes conscious, or if he is tired, he can ask his bystander to continue CPR. And important thing is first call out for help. Call for an ambulance, start the CPR, and one more factor which is very important is the defibrillator is available. There's many public places where automated defibrillators are available. So just have to place it on the chest and press the trigger button. It will sense the heart beating and deliver a shock. This will reactivate the heart functioning and make the person come back to their normal cardiac activity. Till that time, cardiopulmonary resuscitation has to be continued till an ambulance team arrives. When the ambulance team arrives, they will continue CPR, and if necessary, they will intubate the patient and continue respiratory support, and they will defibrillate the patient. And if this is confirmed because of a heart attack, immediate angiography and angioplasty has to be done. And if CPR is not initiated, then they will have hypoxic brain damage, and the results are bad. Then out of hospital cardiac arrest, like in a house or in a public place, in a cardiac arrest happens,
Right.
People should start CPR immediately. That is the ideal scenario that has to be followed.
All right, start CPR immediately. So, Dr. Mujawar, can you please explain the process of CPR and how it should be done? What to watch out for? What should not be done when performing CPR?
CPR help to keep the patients of cardiac arrest alive and increases his survival. Okay, when patient develop a cardiac arrest, the CPR can help the patient to keep alive till emergency team comes and help for the survival of the patient. CPR can be done by the lay person also. While doing CPR, first confirm that patient is not breathing. Then patient then keep the patient lying on his back. You kneel at the shoulder of the patient, keeping the heel of your palm over the patient's chest and intermingle your both fingers. Okay, and keeping at the center, in between the two nipples in the center of the chest, you can begin the chest compression. Make sure that your elbow is straight. Your weight is do the compressions, and at least the compression should cause 5 centimeter depression of the chest, and you should allow the time to the chest return back to help to the cardiac arrest to be satisfactory. So give at least 100 to 120 compression per minute. If you are alone, continue only the chest compression, and the chest compression also shown to make the patient survive till the emergency team arrives. If you are available any other assistant, then he can be helped in the giving the assisted breaths.
All right. Well,
so
thank you.
cardiopulmonary resuscitation help the patient to keep alive till emergency team comes.
That's right. Well, we'll continue this conversation. Time for us to slip into a short break, but we'll return with more questions for the doctors. Welcome back. You're watching Health and Wellness, Save a Life. We're talking about the importance of knowing about CPR and heart disease. Let's go back to the doctors with our questions. And Dr. Huck, what if the person who recently underwent open heart surgery and then has a cardiac arrest? Can we perform CPR on such patients?
This is a very pertinent question, Gagi, because after the open heart surgery is performed for various conditions. Like we have done for bypass grafting for coronary blockages, we have done for open heart surgery for a valve replacement surgery or for a septal defect. When these surgeries are performed, patients tend to usually stay in a hospital for a week or two, and then they are discharged. If the cardiac arrest happens during the stay in hospital, then the outcome of the therapy is good. Means these patients are usually given a defibrillation and then they are tried to save their life. And these patients usually tend to have cardiac arrest because of accumulation of blood or water around the heart or accumulation of air in the chest, which needs to be decompressed immediately. Certain patients are taken up for retrosternotomy and taken care. It has got the best survival. Almost 80% patients survive in hospital with cardiac arrest post open heart surgery. But the problem starts after discharge. Once these patients are discharged, the bone is cut for an open heart surgery and it is restitched back. It usually takes 40 to 50 days or 60 days for healing, complete healing, although the approximation has been done after the surgery. But during this period, CPR, aggressive CPR can worsen the patient. Outside the hospital, when aggressive CPR is given, the sutures may give away, and this invites a lot of infection and complication. Whereas after 6 weeks or 2 months, if the patient behaves like a routine, regular, normal patient, any cardiac arrest, like the same thing will happen to these patients, and they can receive full CPR as per routine protocols. Whenever there is a CPR, we have to call the emergency room services and present to emergency services as early as possible so that the life can be saved. Every minute passing by, we have a chance of losing the patient by 7 to 10%. That is the urgency in these patients.
All right. Now,
Whereas there is another entity.
Yes.
There is another entity I would like to tell. Commonly the people will get mistaken. That is angioplasty. In angioplasty, we are not cut opening the chest. We are putting a stent through the leg or the hand. And this is a perfectly normal situation to perform a CPR, either in hospital, outside hospital, immediately or later. There is no special criteria or requirement for these patients. They are routinely, they can be taken up for CPR and their lives can be saved on.
Okay, Dr. Bhatt, we talked about how in India, especially, we're seeing a lot of increase in heart disease, and most families have at least one person with a cardiovascular disease. So could you please tell our viewers how important it is for patients, caregivers and relatives and family members to learn CPR?
CPR is an essential skill. Every person should be trained in CPR, including the bystanders, patient family members, even children in schools. The public personnel like police have to be trained to deliver CPR, and awareness of CPR has to be spread in the general public so that they must not see it as an unfortunate event. When a person becomes unconscious, there's a tendency for people to just take photographs and huddle around the person rather than go and help. If you find anybody unconscious, immediately, even if you are not trained, you can initiate CPR. Our only thing to be ensured is the airway. One common cause is aspiration of food particles. So ensure that the airways are open. Turn the person to the right side or left side. Roll them over so that the airways are open. And if they are, check if the person is responding to commands. And call for help. So one more person, if he is around, can summon an ambulance, 108 ambulance, and start chest compression. Nowadays, there is a fear among people to initiate CPR because of the COVID scenario. They think that they can contract COVID. All they need to do is do chest compressions. They need not do any mouth-to-mouth breathing. Just a chest compression will ensure circulation is maintained. It will help the heart to start. Before starting, they can even give a thumb to the heart so that the heart is initiated, heart beating initiated. Suppose there's an irregular heart beating, what we call VT and VF, just a thumb on the lower part of the sternum between the nipples will start the heart. Then they should start chest compressions at a rate of 120 compressions per minute. They should be going at least 5 centimeters compression should happen and the chest should recoil. And this should be continued till the person becomes conscious. Just don't stop. Don't lose your confidence. Continue CPR.
Right.
See, an out-of-hospital cardiac arrest has a 90% mortality in spite of CPR. But there are instances where people have survived even after 6 hours of CPR. So continuous CPR has to be continued till the ambulance team arrives. Ambulance team will have defibrillator. They will defibrillate the patient and they will intubate the person and shift him to the nearest healthcare facility where advanced care, whatever is needed, will be initiated. CPR should be given even for children also. Find a child who has become unconscious, ensure the airway is open, start compressions. Even if your pet becomes unconscious, you can do CPR. It is a very important skill which has to be learned and disseminated among the general public.
All right. Dr. Mujawar, does cholesterol accumulate right from an early age? Is it only after 40 years of age that a person needs to worry about cholesterol?
High blood pressure.
Yes, go ahead.
High cholesterol level. High cholesterol can occur at any age of the patient, and high cholesterol level at any age is increases risk for the coronary artery disease, heart attack, and stroke. So the high cholesterol level at earlier age may be because of the genetic factor, dietary habit, or obesity. If you detect the high cholesterol level in a younger population at early age and we start treatment, we can prevent the heart attack and stroke in this population. So detection of cholesterol at earlier age is very important. Those who are more than 20 years can do their lipid profile level every 5 yearly, and those at a high risk, like those are obese, those having a genetic predisposition, or those dietary habits include a high carbohydrate and high fat diet, that can be done more frequently. So detection of the cholesterol level at earlier ages and starting the treatment will prevent the development of heart disease and stroke more effectively.
Right. Dr. Bhatt, is there a relationship between heart problems and blood sugar?
Yes. It's a very important and pertinent question, particularly in India, where we are considered the diabetes capital of the world. This is because of a predominant carbohydrate-based diet with less fiber. So, as the Western diet has been taken over by our population, there is an increased incidence of diabetes, and we find that diabetes is invariably associated with heart disease. So, diabetes is called cardiovascular disease equivalent. Diabetes is because of a metabolic derangement in the body, and by the time a person manifests diabetes, the metabolic derangements and the lifestyle changes which precipitated diabetes in him would have also precipitated cardiovascular disease. So diabetes by say is itself a heart disease equivalent. So it is like having heart disease itself. This is because the high blood sugars will damage the blood vessel lining. We call endothelial dysfunction. So lining of the blood vessels will get inflamed. So the increased tendency for the arteries to harden. So the increased tendency for clotting in these people. And there will be disseminated vasculopathy and blockages and narrowing and hardening of the arteries throughout the body, not just in the heart, in the brain, in the neck vessels, the arteries in the retina, arteries in the peripheries of the body, in the legs, and the small arteries in the kidneys. So these people have increased incidence of heart attack, stroke, kidney damage, eye damage, renal failure, peripheral vascular disease, because of which they tend to have gangrene and lose their fingers, toes, and end up with amputation. So it is very important for people to be told about the importance of diabetes. Diabetes control is very important. There is a misconception that you need not take diabetes medicine. So it has to be taken on time and ensure that your diabetes is under control. Otherwise, they'll end up having vascular incidences like heart attack, stroke. So this is very important for them to be aware about.
Right. Well, thank you so much, Doctor, and thank you, doctors, for answering all those questions and creating more awareness about this very, very important issue. Thank you all for watching at home. Goodbye.